Okay, chapter 4 of the 6th edition ACE Certified Personal Trainer Certification textbook workbook. And chapter 4 is effective communication, goal setting, and teaching techniques. So this is a great chapter for me to show you a little bit about sort of the study habits techniques that I not only use myself, but highly recommend. So I'm going to kind of show you a couple little things as we go through this chapter. As with all the chapters, again, having the writing material and implement, and I'm actually going to show you a little bit how I would go about structuring some of this. Remember, the goal when we're going through chapters, when I'm studying material, I want to memorize the material, right? Now you say I want to learn it, but at the heart of learning is memorization, particularly when it comes from sort of this academic way of dealing with it. So chapter 4, really good chapter, really good information. Right off the bat, if I'm going through this material, I want to go through it once. I don't want to have to keep coming back because I forgot, and I'm frustrated because I can't remember it, and I'm taking a quiz or whatever, and I don't know the answer. Well, one of the ways to get around this is to do some really simple, basic things. Remember, there's ways you can study, and if you find those ways, a lot of people like to use flashcards, things like that. So they'll write their flashcards and they'll go back and forth all day long, back and forth all day long. There's nothing wrong with that. It's just not a very efficient way to memorize. Again, if you were to just rewrite every time you looked at something, you would cut the memorization time in half. Okay. So anytime you look or access information that you're trying to memorize, if you can read it and then rewrite it while you're doing that, you'll just decrease the amount of time it takes to do the very same thing. Nothing wrong with flashcards. But again, they take a lot of time. Look, exposure to the information is really important. So frequency of exposure is one of those things we always talk about when it comes to studying. So the more you look at it, the more you read it, back and forth. Okay, that's why flashcards, if they're done over and over and over, you can memorize the information. It's not that you can't memorize with flashcards. No, they're very effective. It's the efficiency, and that's what I want to kind of help you with. So in chapter 4, for instance, I'll just show you real quick what we're talking about here, because chapter 4 is going to start off with stages of the client personal trainer relationship, obviously critical, and there's a couple of sub variables that go into that. And so what I want to do is I want to kind of show you a little bit about how I would do this. So right off the bat on page 99, we have stages of the client personal trainer relationship. So basically what I would do is on a sheet of paper is I would write stages, right? I would do the stages. Anytime I can add some visual interest to it, circles, squares, whatever the case is, that's what I would do. And there are 4 of them. Okay, there's 4 of them. There's the report stage, investigation, planning, and action. So right off the bat, right from the get-go, I'm simply going to go ahead and write rapport. And for some of you, this is probably something you already do. But I don't need a, perfect little lined paper to write this all out. In fact, often what you'll find is that if you give some visual interest and you have some physicality to how you're doing your studies, it'll actually make more sense. So I do rapport, then I would do investigation. I would write out the whole word, but you hear me saying it out loud. So stages of, and again, I'm doing this quickly, you would literally write out the entire thing. Stages of client trainer relationship, write the full word. I would go ahead and do this, planning, write out the entire word. And this is how I would do. I would go ahead and write this out. Now keep in mind, the physicality of me writing it and saying it out loud has already, right from the get-go, created an initial level of retention and memorization that's going to be beneficial. Now, if I turn the page over, I'm going to start with the rapport stage. And now you can imagine there's cultural competence, there's first impressions, there's verbal and non-verbal communication. So what I'm going to do is I'm going to do the same thing. This is how I like to do it. And I'm going to use different shapes. So I'm going to write in cultural competence, right? And I'm going to write this one out here. And again, I'm going to use as much paper as I need to write this out. I'm going to take this guy and I'm probably going to move him down here and I'm going to do the same thing. And if I run out of paper, turn it over. Now watch, I could just go ahead and pull this over, right? So I'll do that one and I'll come down here and I'll list them out. Action, I'll come down here and I will list these. Just the fact that I'm writing this and saying it out loud is going to be very, very important. Now remember, once I've gotten this, I can now go through a moderate level of explanation, just for instance. So let's go ahead and now, again, you would be doing this on all of these 4 variables, right? These stages. And then you would pull all of the stages, all the components of each of those stages, right? So what I would do, for instance, and I'll put it back up here. So rapport, I would redo rapport now, and I would have cultural competence. And then what I would do is I would read this again, read through the material, but write down the specific notes or information that are related to that particular area. And again, once this is done, now imagine I've gone through this and I've written it out. This has no more purpose for me, okay? It was the physicality of writing it that was important. So I'll just go ahead and get rid of that. And I would restart the process again. So if I get to rapport, I would write cultural competence, I would read through it. Okay, so personal trainers who have had little difficulty developing rapport with clients, similar, and I would read through it and I would go, oh, that's an important part. And I would simply write that down. And that's what I would circle. That would be a piece of information. Believe it or not, I'm actually memorizing that. Once I get through that entire process, once I get through this entire sub variables, verbal, nonverbal communication, right? I'm simply going to be writing down, and I've gone out of focus. I'm simply going to be writing down these points, and that's kind of the idea. Is that as I'm going through this, and I hope that was helpful. You know, I went through it fairly quick, but the point is that I've just shown you basically what I do. I've got my book, I've got my paper, I've got my writing implement, and I am essentially reading it, going through it, rewriting it. The problem is when you've gone through it, and this is one of the reasons why I use this technique, because I don't want to have to go back and go, oh man, what did I, you know, let me go back and look for it. No, and you know, people do, you probably do it yourself, right? No, you want to go ahead and get it the first time. So first impressions, professional boundaries, and as you write it over and over, remember, in one sense, I can put that aside and I can take what I wrote and rewrite it. Or like you saw me do, I'm done with it the first time, get rid of it and do it again until it starts to lodge into my memory, particularly my mid and then long-term memory. So chapter 4, okay, so I've gone through some of those with you. And I hope that helps you to understand the study technique that'll help you memorize. By the way, the reason I did it with chapter 4 is because a lot of this information that I literally just went through with you is for the most part intuitive. I mean, what is rapport? Rapport is a relationship that's built on understanding and trust. That's the definition of rapport. Our relationship, right? Trainer-client, built on understanding and trust. Ideally, that's what's going to happen. It should happen with your doctor. It should happen with your nurse. It should happen with any clinician. It should happen with anybody that you have a strong or developing need for relationships. So the same thing should happen with your trainer. Get it? So rapport for the ACE model, believe it or not, the mover method, the ABC, right? Ask, right? break down barriers. All of those are fundamentally designed on this these stages. So you got to develop rapport. That begins from the very get-go with your client. They need to understand that they can trust you, and you guys have a mutual, a mutual understanding of what it is they're trying to accomplish. Then, as you're, and by the way, you're developing rapport the entire time that you're with your trainer. It just gets stronger and stronger. Now there's an investigation phase, right? And again, the reason I'm doing this is because it should be intuitive to you. Okay, this is intuitive. Okay, I don't want to upset my client from the get-go. I want just the opposite. I want them to feel comfortable with me. Now I want them to feel comfortable enough to where we can discuss issues, their health history, things like this, where now we can start a planning process, right? And then we can start the action component. And those are the four basic steps. Each of those steps have some basic elements related to them. To develop rapport, you got to have empathy, for instance. You got to be competent. Cultural competence is important in today's culture. The first impression is critical because you only have one shot at it, right? What do they say? It's the one thing you only have one shot at. That's a first impression. So you want to make sure that it's a good one, and the client feels comfortable with you after that initial engagement with you. The ability to communicate. Now, verbal, nonverbal communication, critical, because on page 103, you got some bullet points. There is entire classes you can take just on nonverbal communication and cues. You're not using them to trick people. You're not using them as this slick sales technique. No, you use nonverbal communication to ensure that your development of rapport is effective. Okay, people have to understand that the level of trust that you're trying to develop with them is legitimate, right? You're not trying to pull one over on them, and the goal here is to be able to communicate both in the verbal, but also in the nonverbal way, so that there's an understanding of trust, and then this idea of mutual understanding that comes a lot with nonverbal. If you're uncomfortable, it's going to show through. Highly recommend, by the way, highly recommend, once you're done, you pass, you become a certified trainer, whatever the case is. I highly recommend you study much more on nonverbal communication, so you feel comfortable when you're with folks. I feel a lot more comfortable with somebody that's confident, that is displaying effective nonverbal cues. So voice quality, eye contact, facial expression, hand gestures, body position. I mean, just think about right now as you're watching the video, all of the nonverbal cues that I'm giving to you, and there's about 5 or 6 that I'm constantly displaying to you on a regular basis as I go through this video with you, and you should be picking up on them. There's a reason you feel, as you're watching a video, whether it's this one or any other you watch, there's a reason you feel either uncomfortable, which you shouldn't feel at all while you're watching this, or very comfortable, or you can sit back and you can go, okay, why? Because if you listen to the quality of my voice. I'm speaking in a way that has a level of quality in the voice, and speed and tempo and loudness or softness, right? That makes you feel comfortable or not comfortable. Eye contact, okay? If this is the way the video is all the time, and I never give you any eye contact, that kind of makes people feel a little uncomfortable, as you're starting to feel right now, as I'm not even looking at the camera. But as soon as I look at the camera and I give you eye contact, that's generally the way that humans interact with each other. We look at each other. We have eye contact, but don't be doing this with your client. Okay, that's not effective either. That's weird. Facial expressions, smiles, intensity, right? Looking up. All of these things are normal. Normally, they're not conscious. It's something you develop as time goes on. And the big thing that you noticed, of course, since you've been watching the video, are my hand gestures, right? I'm from New York, so I can't talk without my hands moving. Hand gestures are very important, because without hand gestures, you have to force yourself. That makes people uncomfortable. So don't worry about lots of hand gestures. They generally go along with your verbal communication. So again, there's a so much information just on nonverbal body position, this stuff where you're talking to people like this versus talking to them like this, versus getting, there's many cues, many subtleties of your body position that can help a person feel comfortable or feel uncomfortable. And so that's kind of what this area is about. I've spent more time on that than on these other areas because it is really important. Professional boundaries. These are really, really very important. Now look on page 104. What do you got? You got a table. Okay. So as soon as you hit a table, what do you do? That's right. Let me see, as long as I don't get as long as I get my stuff in focus. Um, Normally what I do is I just write the table out. So table 4.1, this is what I would do. I'd say body language, um, and then potential meaning. What is the meaning of it? And I would write this out. Crossed arms. Now, write this out bigger, obviously. Give yourself a whole sheet of paper to do it. And then write it. It's the physicality of writing that is critical. So let me get out of that. And the idea is that once you rewrite it, it will help your memory. Again, think about this. I've written this out, written it out. I don't need it anymore, but I will do it again. Normally, just as a just as a real world scenario, I'll do it normally 3 times, 3 times on one shot. I'll rewrite it, get rid of it, do another one, rewrite it, take a little bit of time. Third time, I'll redo it. It gets stuck in there a little bit. Again, keep in mind, I'm going to go through it. I will go back, right, and review my material. But the idea is that by doing that initial reading and rewriting, just helps with the memorization versus just reading it. You're just not going to remember the material if you just read it. I mean, unless you're one of those, 1/10 of 1% of learners that's literally able to visually look at it, memorize it, and then you're done. If you were like that, then you probably don't need to be doing an overall study anyway. What you got to do is read it. So table 4.1 gives you that information about body language indicators. Look, potential meaning, there's a lot of potential meaning with crossed arms. Anger, defiance, or disinterest, unless the client is cold. Well, okay, let's take a little break from this, because this could also mean that I'm very comfortable, believe it or not. Okay, so some of the information that you're gonna get here, you got to know it, but there's a lot more to it, because this could be a very comfortable. Normally, what we used to think, right, before the real smart people did lots of research on this, is this was, I'm closed and I don't want to talk to you. And well, no, actually, in reality, this is more often than not just the opposite. This means, well, look, watch the difference. Watch the difference between this. You see the difference? It's no longer the crossed arms. That's the indicator. There's a multiple cue. There's a multiple cue situation going on here. There's this, and then there's this, right? Have you ever done this? You sit there and you talk to somebody and you sit there and you go, I often do this. I'll sit here and I'll do this. This is a very comfortable. This means I actually do want to talk to you. I don't have to go like this to let you know that I'm open and comfortable. So just keep that in mind. Again, a lot of what you're going through here is something that is so important to use in the real world once you're training people. Professional boundaries. Look, we do have to help people to understand. Don't be getting in people's spaces, and don't be taking people out for drinks on the week. These are professional boundaries. It's really important that you maintain the general cultural understanding of what professionalism is. That's what you get there, dealing with difficult clients. Yeah, that's always of interest. How if you can develop rapport with an individual. Everybody's going to be different, but it'll help you to deal with those clients that are a little bit more challenging for whatever reason. They may be socially, socially a little bit more immature, or whatever the case is. and you have to know how to deal with that. That comes from the development of rapport first and foremost. It really is. So then there's the next stage, investigation, and that's really sort of where trainers normally find themselves stepping into the training scenario, which is we start with the gathering of data, but of course rapport is first. Now we get into investigation, active listening, this idea of motivational interviewing. There is a good apply what you know box. Highly recommend that you read through that, because remember, a lot of this comes down to combining the stages of change model into this chapter as well. They're not separate in practice. They are separate in academic learning, but they're not separate in practice. We're always using stages of change. We determine what their stage of change is, or we get close. And then we're applying and utilizing all of these techniques to help people to feel comfortable. And so active listening, right? Active listening versus just passive hearing. What's the difference? Active, right, versus passive. Active, I'm actually listening to somebody and I'm going, oh, okay, got it. Can you elaborate on that? Tell me a little bit more about that. Why did you stop training, or what happened? Why did you look to, this type of training routine versus going, why did you do? And that's active listening. That means I heard what you said. I can reiterate it. And then I'm going to ask you some open-ended questions. That's the whole concept of motivational interviewing. And then, of course, take a step back, page 109, mover method. And here's a great little informational box that shows you the ABCs. Remember, that's what these boxes are doing for you. Every time you get here, ACE wants you to stop and see what this looks like, kind of in a real world scenario. So the personal trainer says, you mentioned wanting to, now, by the way, you're probably not going to say it like this, but they're doing the best they can. This is kind of the idea. So, you said you wanted to improve your current lifestyle by being more physically active, blah, blah, blah. And the client says, at this point, I would say that I'm, I am at a 6 out of 10, because you've asked them on a scale of 1 to 10, where you at? Now, that's the way I would say it. So on a scale of 1 to 10, where you at in the importance of this? How important is this to you? Seriously. Well, I'm at kind of a 6. Okay, gotcha. If it's a 6, what is the suggested next way you're going to respond? That's great. Why a 6 and not a 3? Right? That's a way you're starting to ask these open-ended questions that get people start to talk. And that's what that mover method box is going to help you understand. It should give you some, it should give you some insight, or at least some ideas when you're actually talking to people. You could also say, wow, 6 out of 10. How can I get you to an 8 or 9 out of 10? What would want to, really motivate you to answer 8 or 9? And they might give you another response similar to that. Move into table 4.2, spirit of motivational interviewing. And that's pretty much giving you a little bit of recap or review from chapter 3. In one sense, because we're trying to understand stages of change and how that's going to assist and help through the motivational interviewing process. Now, just keep in mind, motivational interviewing itself has a number of variables that you need to know that allow you to kind of focus and work within the stage of change that an individual is at. Because motivational interviewing, at the heart of motivational interviewing, is trying to get people to answer open-ended questions, collaborate with them, and collaborate, get them to agree with you, right? That's the concept of acceptance. You have to display compassion. We have this concept called evocation, which is the drawing out of information. Quite often people in pre-contemplation, for sure, Just not interested in talking about it, but if you can get them, if you can evoke, in other words, draw out from them some of the things, the feelings, or whatever is stopping them from wanting to make behavioral change into a healthy lifestyle, that could be the process. So again, table 4.3 now, the core communication skills. Here's my recommendation with table 4.3. I'm not going to recommend that you literally rewrite everything from table 4.3, but what I do recommend is that you know what the definition is for the skill. So, and asking open-ended questions are blah, blah, blah. Offering affirmations, know the definitions, okay? The importance is what it is. The examples are just helpful. But those two columns, the skill itself, you really need to know what those skills are and what the basic definition is, because those are actually important in the real world as well as when it comes to test taking. How do you respond to difficult disclosures, right? Somebody says something to you or gives you information that's kind of a challenge. For sure, I've had that. I've had that more times than I can shake a stick at. There's folks that will literally tell you, you might be the only one that they tell you that they have an eating disorder. You know, they might tell you, I've just been depressed for a long time. Now, again, I'm not going to tell you exactly how to respond to that, but there are ways or at least things to consider when people do come at you with difficult disclosures. Again, within your scope of practice, there's so many things that can come at you, but you got to be really, really careful. If somebody says I'm depressed, whatever the case is, look, that could be a medical condition. It could be brain chemistry stuff, could be hormonal, whatever the case is. That's something that you have to really um, refer to a medical practitioner. Of course, true eating disorders that are clinically diagnosed, man, you've got to get people to physician for that. So the next stage is the planning stage. Here we're talking about setting goals, goal setting theory. Very important. The SMART acrostic, right? Specific goals need to be specific. You need to be able to not just know the goal and get its specificity, but you got to be able to measure it, right? Because ultimately, you can want to lose 20 pounds, but how are you going to measure that, right? That, scale wise, body fat wise, whatever it is, you can measure those variables, right? So specific goal also needs to be measurable, right? Attainable. R is relevant, almost forgot it, relevant, and then timely, we would say timely, but ACE uses the term time bound. When people say, I want to lose 30 pounds, well, that's great. That's pretty specific. 30 pounds is pretty specific. I want to lose 30 pounds of body weight, whatever the case is. How are we going to measure that? Got it, no problem. Body weight, I'm going to use a scale if that's the case. But then my client says, yeah, and I'd like to, I guess I'd like to lose 30 pounds in about 3 years. Look, is losing 30 pounds in 3 years attainable? Of course it is. Not only is it attainable, you can do it in, 4 months, 4 months, if done right. Is it relevant to the person? Absolutely, because they want to fit into their, dress or being whatever the case is. But is it timely or time bound? Well, yeah, but that's too long of a time frame. I don't want you to think that's too far ahead. I want you to bring it back to a real timely scenario, which would be 6 months, for instance, just as a case. So the SMART goals are helpful. Definitely want to write them down. There are a number of variables that go into goal setting, such as commitment, right? Importance, self-efficacy, feedback. And by the way, just so you know, you're going to see a lot of terms spoken about over and over. Here is one of them, self-efficacy, right? And so that should be a little bit of a review. It kind of ties things together. Remember, if you look at it, it's just a ton of material that you're trying to memorize. That can be overwhelming. But if you can kind of pull it together and create sort of a cohesive view of the material with your client, it can actually make more sense when you're looking at a test question, just as a for instance. So SMART goals, of course, fitness indicators for SMART goal setting. So now table for again, I'm not going to recommend that you memorize it, but what I do recommend is that you should be able to, for sure, look at each of the fitness indicators. And for those that you would know intuitively already if you work out and you exercise. Body weight, body weight is easily measured, right? Because notes for goal setting. Some of these, if I did this and I asked you resting heart rate as a fitness indicator, what are some things that you know about resting heart rate? Well, I mean, resting heart rate should, right? And you'll learn this, of course, later on, but resting heart rate should go down. The more fit you are, the lower your resting. Now, you may already know that. Maybe you don't know why that happens, but at least you already know it. So that's one of the tips is that trainers have their clients measure resting heart rate, first thing, whatever the case is, but that's an indicator that the training is effective. That's the idea with this table. You should be able to, and some people would put these on flashcards. Again, not a bad idea, but I would say if you're going to put it on a flashcard, you write it down, put a couple of words, not the entire sentence and paragraph that they have here, but make it so that you can read it back and forth. After some time, I would get rid of all those and then rewrite new ones. See, I just got you wasting paper, but that's the way you memorize. At least that's the way I do. Okay, so table 4.5, how to set health and fitness goals that motivate clients for long-term adherence. This is just good. This is just good real world material. Okay, memorize it. Maybe not that necessary, but I would definitely look at that. Make sure you understand each of those. Again, most of it is intuitive. And so you're not going to have to necessarily rewrite that table unless you have time and you want to. Okay, apply what you know, good one because it has bullet points. Goal generating questions, real world stuff. Again, if you're going to see exam questions on this, it wouldn't be too many like that, but for sure they would use something within that particular box. So now you're getting to generating ideas, discussing options, formulating a plan. Remember, the idea is that you're in this planning stage with your clients. What are those stages? Remember what I did at the beginning with my camera that went out of focus, right? Was now you're at the planning stage. What are those? Generating ideas, discussing options. So formulating a plan, evaluating the exercise program. Grab each one of those and look at those. Make sure you understand them. Now you move on to what I would do. Boom, I would take another sheet, action stage, self-monitoring approaches. I would write that down, I'd circle it, and then I would read through it, and I would take a note or two on some of the basic concepts. And that's how I would go through that. Effective teaching techniques, and then the stages of learning. Now, again, you'll notice that self-monitoring approaches is just 2 paragraphs. It's not a ton of material there, but as soon as you get to the teaching techniques parts, boom, now we've got all of page 122, page 123, preferred learning style indicators, table 4.6. Write that down. Redo that table. I would know it. I try to know that by heart. Again, it's intuitive. It really is. So visual, auditory, and kinesthetic learning styles. It's one of the things we do just from a memorization standpoint for studying. Same thing. There is the tell, show, and then do concept. The way of helping individuals learn whatever the strategy is that you're trying to teach them. Right. Normally, it's skills for resistance training, right? Like using a TRX requires a fair amount of skill. Doing balance training requires a fair amount of skill. So you tell them, okay, so here's what we're going to do. I'm going to have you lift up your leg, and we're going to go down. And you're going to go down slowly, slow and controlled. And here's what it looks like, right? So let me go ahead and show you real quick what it looks like. I'm going to go like this, boom, and then here, you try it, right? And then that's the tell, show, and do. Can be very helpful. It's just a part of the teaching process. And of course, providing feedback, providing reinforcement, correcting errors. Keep in mind, go back to rapport. Make sure you're not talking to people in an inappropriate way. Some people do not like to be, you know, told and scolded that they're doing something incorrect. On the other hand, some people that they don't want you holding their hands. They don't want you, you know, being real. No, tell me if I'm doing something wrong and show me the correct way to do it. Right. So those are the parts of this, providing feedback and then modeling. You know, look, for the most part, this, even though it's at the end, this is really one of the most important things you can do in the real world as a trainer. Are you exercising on a regular? Are you eating well? That's called modeling. All it is, do as I say, right? Do as I do, right? If you do as I say, but don't do as I do, because I go out and I eat potato chips, and if I do that, that's not good modeling. Normally what trainers try to do is to lead or show by example, and that's just called modeling. Make sure you're training correctly. Make sure that you're eating well. Make sure that you're following the very guidelines that you're asking clients to do. When I first started training people, I mean, decades ago, as a competitive bodybuilder, the idea was that I'm just having you do what I do. I'm just having you train with weights, and that goes back to that traditional way of thinking that we had talked about in the previous chapter. But I did bench presses, and I did rows, and I did lateral raises. Guess what my clients do? They're doing bench. They're doing everything I did. It was the sort of the ultimate modeling of the training experience. Got them to eat, right? Good amount of protein, low fat, low salt, low sugar, right? That's the way we ate. And so we live that, and that's why we told our clients, if you're not doing that, that's important that you do that, and that's why this is in here. So it's critical that you actually model a lifestyle that you would like your clients to follow, and that's why that's in there. Expand your knowledge. You can actually use what are called behavioral contracts. Nothing wrong with that. That's what Figure 4.3 is. And then a good ending. Apply what you know. Incorporating effective communication, teaching techniques into the daily interactions. So there's a lot here in chapter 4. Again, I hope my showing you that the way I would do the study process was helpful. Keep in mind the read, write, recite method that I use is not done once. You do it once, and anytime you go to reread it, you should always rewrite it, which is, again, it's not that flashcards are not good. No, flashcards are great, but there's pros and cons to flashcards. Definitions are great, to that exposure that you have to them back and forth and back and forth. You use those, but do not discount the rewriting of it, because there's an efficiency issue that you lose when you just read. Just reading material is not an effective way to memorize it. That's why you got to do it over and 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 over. Well, if you rewrite it, you'll memorize it that much faster. So there's an efficiency issue. Go ahead and read your summary on chapter 4, and then of course we'll be moving into chapter 5, which is going to be on pre-participation screening, and that's going to start moving us into more of the very specific ways that you deal with the IFT model. So end of chapter 4. Hope that was helpful, and look forward to seeing you then in chapter 5.